Hoopers? Did you injure your ACL, had surgery, and now are working on your way to get back to basketball? We're gonna go over one drill you have to be working on if you had ACL surgery. So this is gonna be a reactionary drill. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. Today we're gonna be talking about a reactionary drill that you can do after ACL surgery. As you notice, ACL surgeries are one of the most common surgeries that basketball players endure, and the recovery is one of the hardest ones to recover because you're looking at least 10 to 12 months. And one of the biggest components that most people don't really appreciate or don't look too much into is the reactionary component, being able to react. Because when we play a sport, we have to react. And during ACL surgery or recovery, you're not doing so much reactionary because you're really working on strengthening, jumping, but you have to be training the brain to react. Because what happens is when you get back onto the court, you struggle to react. You want to move one way, but your brain doesn't coordinate with your body. So we're gonna show you guys one drill that you can do with the PVC pipe. And a disclaimer, before you do this, you have to be clear to doing some running, jumping, cutting, because this is gonna be more of a reactionary, pivoting, and stepping. So this drill is gonna involve a PVC pipe. You're gonna be in a defensive stand position. And this is a little reactionary, but a self-reactionary, where you kind of push the stick and then you have to react to go get it. So the drill looks something like this. You're gonna be in this position, the stick's gonna be here, and then you're gonna push it any direction you want. So normally I start here, and then I push it this way, and then I have to push off with my right leg and stick with my left and catch it with one hand, and then come back to center. So this is gonna help you with that reactionary first step on defense where you push out, try to stop the guy, and that's really hard for people after ACL recovery to start really getting to that good defensive flow. Especially for myself who had ACL surgery, when I played defense early on, it was hard to react because I didn't do these drills. So here's a drill I like to use with my current athletes. So you use the stick here, you start, you press out and come back. So as you push, you need to push off the right leg. Don't so much just reach. I want you to push. So if you can see me here, I'm gonna go slow motion. As I push here, I'm gonna press on this leg to push me and get in this direction. And as you notice, a lot of coaches tell you guys, basketball players, don't reach. So this is teaching you how to push, then reach. Not necessarily just reaching out. That's how you're gonna get the foul. If you push, step, that's how you're gonna get the charging foul, which is what we want, and just get in front of your defender. So here's at the end of the drill, you're gonna get in that defensive athletic position. If I push the stick, I'm gonna step and come back. Push the stick, step, and come back. What you can do to progress this is you have a partner or someone now be in front of you and they push the stick. Then you have to react to wherever they go. Right now it's a self-reactionary drill where you're reacting based on where you're gonna push it. So you push, step. But when you have a partner in there, then it's a little more open environment so they could push it any direction and then you have to react to it. And they're in front of you just pushing the stick. And remember, you're always pushing, stepping, and then coming back. Don't just get lazy with it and just reach out. So I really want you to get in that position where you push, then get it. And so that's a really good reactionary drill that I like to use with athletes before they go back to basketball, before they transition to defense. That way you start getting used to reacting on the defensive side. That way you're ready to go back into playing defense in basketball. Hopefully you guys learned a little bit about this drill. And remember how I told you guys about ACL recovery? It's a long recovery. But you gotta make sure during this long recovery, you're adding elements where you're training your brain, getting used to reactionary components, because reaction is a huge component for basketball. You have to react if you're playing on offense or defense. So you gotta start training the brain, training your legs with your brain to react on external factors. So this is a good drill I like to use with athletes, in that 5-6 month range when they're already back to running, jumping, and we're just forcing on quick reactionary movements. And it's a fun little drill. I usually like to go 30 seconds to a minute, and then you just start hitting the stick faster and faster, so they're moving faster and quicker. And I usually have a partner involved. First do it yourself, get used to it, then have a partner, which really adds that reactionary component to it. If you guys have any questions about ACL recovery, back to basketball, send us a comment below or check out our website. We work in Los Angeles. We work with a lot of athletes getting back to sport. But hopefully you guys liked this video. If you guys did, hit the like, share, subscribe button, share with friends and family. We are the Basketball Doctors. Let's ball for life.